Hello everyone, welcome back to the channel. Today we will be talking about depression. Let's start with what is depression. Feeling down, sad or desperate happens to us all the time. However, people with diagnosed clinical depression have these feelings longer than others. It may affect their work, relationships, and quality of life. It's not easy to have a life where most of the time you are feeling worthless, hopeless, or depressed nearly every day, depending on the severity of the depression. Depression is one of the most common mental health problems. Depression is a potentially life-threatening disorder that affects hundreds of millions of people all over the world. It can occur at any age, from childhood to late life, and if left untreated, can be fatal. So what causes depression? Genes. Chances of getting depression increases if it runs through your family. Mental disorders in general are believed to be inherited. Environmental. It differs from one person to another. It depends on the level of stress you face throughout your life. Any abuse as a child, being neglected, or having low self-esteem. Brain chemical imbalances. Functional deficiency in the brain neurotransmitters, which are serotonin, dopamine, and norepinephrine. They are responsible for many behavioral symptoms such as mood, vigilance, motivation, fatigue, psychomotor agitation or retardation. Abnormal function and the behavioral consequences of depression may arise from alerted synthesis, storage, or release of these neurotransmitters. Physical illness. Living with a chronic illness can contribute to being depressed, like having strokes, heart attacks, cancer, or an underactive thyroid. Symptoms. Symptoms of depression. Symptoms can vary from one person to another, but these are the most common symptoms that can occur. Feeling sad and or crying spells. Feeling worthless, guilt, regret, helplessness or hopelessness. Sleeping a lot more or a lot less than usual. Withdrawal from social situations, family gatherings and activities with friends. Reduced sexual drive. Gaining or losing weight. Suicidal thoughts. What are the natural ways to treat depression? People might want to start fighting depression on their own before trying prescription medications. Sometimes changing your lifestyle can help you put the missing pieces together and help you get through it. Exercise. Exercise has a positive effect on depression due to an increased release of the beta endorphins following exercise. Endorphins are related to a positive mood and an overall enhanced sense of well-being. Also leads to an increase in the availability of brain neurotransmitters, for example serotonin, dopamine, and norepinephrine, that are diminished with depression. These neurotransmitters increase in plasma and urine followed exercising. These neurotransmitters increase in plasma and urine following exercise. Eating healthy food. The diet may have a significant effect on preventing and treating depression for the individual. Balanced dietary patterns such as the Mediterranean diet and certain foods such as fish, fresh vegetables, and fruits have been associated with a lower risk of depression or depressive symptoms. On the other hand, sugar intake was associated with depression because it altered endorphin levels and oxidative stress. Adopting an anti-inflammatory diet may be an effective intervention or preventative means of reducing depression risks and symptoms. Having a routine. Having a routine removes the daily stress burden of not knowing what to do. So if you plan what you are going to do every day, it will make your life easier. Having habits and routines will make you get more done with less mental energy spent. As you wake up every day knowing exactly what you are supposed to do, instead of going randomly throughout the day. Become more assertive. This is specifically for people who are passive or passive-aggressive when dealing with other people. You get stepped over a lot, people take advantage of you, and you want to please them. This can put you in a position of frustration and resentment, so therefore you will eventually become depressed. Learning to say no can be the first step you can take towards becoming more assertive, therefore having less stress and burden and less depression. Sleep. There is strong evidence to support the role of the sleep-wake cycle and circadian rhythm in the pathogenesis of major psychiatric disorders, particularly depression. Keeping a consistent bedtime and wake time sets aside the requisite 7 to 9 hours of sleep and gives your body the opportunity for a full night of sleep. Additionally, establishing a nightly routine provides a cue for your body to begin winding down and prime itself for sleep. Natural supplements for depression. Omega-3. Supplementing with both DHA and EPA can help reduce symptoms of depression. Omega-3 fatty acids were shown to be more effective than a placebo for depression in both adults and children in small controlled studies. Dose: 1 to 2 grams per day of an EPA plus DHA combination with at least 60% EPA for major depression. St. John's Wort. St. John's Wort is a popular herbal remedy recommended by traditional Chinese medicine practitioners for patients with a mild to moderate depression. St. John's Wort has a comparable efficacy and safety when compared to SSRIs. Follow-up studies carried out over a longer duration should be planned to ascertain its benefit. Common dose used in studies has been around 300 milligrams 3 times a day as a standardized extract. You can start by taking 1 capsule per day and then work your way up to maximum of 3 capsules per day. Precautions. Herbal remedies aren't recommended for pregnant women, children, the elderly, or people with certain medical conditions or taking certain medicines. Conclusion. Depression can be difficult to live with. Many people choose to fight it on their own. If you already tried everything discussed here and still feel like it didn't work, consider talking to your healthcare provider and discuss the possibility of starting a prescribed medication if applicable. Speaking to a therapist can always help. Thank you for sticking till the end of the video. See you in the next video. Bye now.